Well, welcome everybody. We are doing this presentation back by popular demands. We had done this earlier in the year and we wanted to revisit it again. It is Medicare open enrollment time. I believe through the first week of December. David can correct me. So this is prime time to think about Medicare. And honestly, when Cindi and we work very closely together on planning for clients of the firm and really outside clients, one of the issues that come up frequently is Medicare. It's very confusing, it's overwhelming, and we really felt that having a specialist come in and explain it would be very helpful to you and actually any of the internal members of our firm here who are joining as well. So that's why we brought David Penrose in. David has 34 years of experience in Social Security and Medicare. He is the founder of Benefit Reps of America. He focuses on helping individuals obtain Social Security disability benefits, in addition to helping clients understand and choose the proper Medicare plan, which you're going to see. It is a lot to take in, and he does an incredible job with that. He also worked for the Social Security Administration for 15 years before starting Benefit Reps of America. He's located in Rochester, New York, but he works with clients all over. His company has won numerous awards for helping thousands of people with their Social Security, disability, and Medicare needs. So with that in mind, I would like to turn it over to David so he can begin going over his incredible content that he has.
Thanks, Jean. All right, like Jean said, I used to work for the Social Security Administration. I was with Social Security for 15 years. I left Social Security approximately 19 years ago, started my own disability representation firm where we help people obtain Social Security disability benefits, and we also help people with Medicare benefits. From a Medicare perspective, we are what is known as independent licensed Medicare brokers. So what that really means is that I represent most of the large insurance companies that have Medicare plans. So when I help clients looking at all the different insurance companies and trying to help them choose the most advantageous plan for them. As most people know, and probably why a lot of people are here today, Medicare can be very, very confusing. So I'm kind of here to give you the basics, hopefully take away some of that confusion, and then hopefully help you plan for your Medicare needs in the future. After the presentation, if you still have questions, I will try to get back to you. If not, you can always call my office and talk to myself. We have 3 other Medicare representatives in the office as well. So there's 4 of us licensed in our office that can help you with Medicare questions. So let's get started with what is Medicare. Medicare is a federal health insurance program for U.S. citizens and legal residents. It's funded by taxes that you pay while you work. Okay, so it's not, a lot of people refer to it as an entitlement program. It's not an entitlement program. You earn the right to receive Medicare insurance based on your work history and paying taxes. It is individual health insurance coverage. And as most people know, it covers people that are 65 and older. But what a lot of people don't know is that it also covers people that are on SSD, which is Social Security disability benefits. It also covers people who have end-stage renal disease or Lou Gehrig's disease, ALS, no matter what age they are. Medicare is not a family health plan, so Medicare is for individuals only. A lot of couples wonder, well, if I get Medicare, will my spouse get it? And yes, eventually, but your children won't. So the Medicare only covers the individual worker and possibly their spouse. It's not Social Security. A lot of the confusion comes in because people have to deal with the Social Security office when they're enrolling in Medicare, when they're paying their Medicare premiums. But again, it's actually not Social Security. Medicare is their own independent agency. It's what's known as CMS, Centers for Medicare Services. And what happened is when Medicare was first created, they tasked the Social Security Administration with the the job of signing people up and then collecting any premiums that are due for the Medicare. So it's not actually Social Security. And it's not Medicaid. A lot of people get Medicare and Medicaid confused. Medicare, again, is an earned benefit based on you working and paying taxes, where Medicaid is a needs-based health insurance program that's administered through the states and the counties. It's generally for low-income people. So it's totally different than Medicare. It is possible to have Medicaid and Medicare at the same time. We do have a lot of clients, our disability clients, that have both Medicare and Medicaid. And again, Medicare is not free, and we'll go into more details with that in a minute here. How long? Let's talk about the four basic parts of Medicare. Everyone knows that there's Part A, Part B, Part C, Part D, but kind of what does it all mean? And we're going to break it down here in more detail. But just to start, Part A in its general sense is hospitalization coverage. You go to the hospital, the Part A Medicare covers some of your hospital costs. Part B is known as medical insurance. That covers you when you go to the doctors. It covers some tests. Part C is Medicare Advantage. Medicare Advantage hasn't always been around. The Part C started, I believe it was somewhere around 2006 that the Part C started. And then Part D is prescription drug coverage. So we have these four parts. I'm going to go into more details about them all here as we go through the presentation, and we'll break it down for you. So original Medicare, Parts A and Part B. It's offered by the federal government, as you know, and original Medicare covers a lot of things, but it doesn't cover all of your care. And it generally has high deductibles and co-insurance or co-payments. And we're going to look at a little more detail there as we go through the presentation. So Part A, again, is hospitalization coverage. Okay. One of the biggest faults with having Part A by itself is that there is in 2025, there is a initial deductible if you go into the hospital of $1,676 for days 1 through 60. You pay the first $1,676 while you're in the hospital. Part A does help cover some skilled nursing facilities, okay, not long-term nursing facilities, but skilled nursing facilities, 20 to 100-day limit. Generally, Part A will help cover some of those skilled nursing facilities after you've had, say you've had a knee replacement and you need to go into a rehab facility for, a few days, it'll cover that. But it's not long-term care, okay? Part A does cover hospice care. God forbid if you have to go for hospice care, it will cover that. And it does cover some home health aid, but on a very limited basis. Again, generally after you've been released from the hospital, it'll cover a little bit of home health aid service if you need that. Part B covers doctor appointments, outpatient care, preventative services like screenings, vaccines, some physical therapy, occupational therapy. Again, it covers some home health on a very limited basis. And Part B also helps to cover some durable medical equipment such as wheelchairs, walkers, hospital beds. Okay. In 2025, there is a Part B deductible. The individual, if you only have original Medicare Parts A and B, with Part B, you have to pay the first $257 per year out of your own pocket. Okay, before Part B will cover anything. So let's talk a little bit more about the Part A deductible. I mentioned in the earlier screen that days 1 through 60, when you're hospitalized, you have to pay the first $1,676 out of your pocket for that. Days 61 through 90, you're paying $419 per day. And days 91 through 150, you pay $838 per day. And then after 151 days, it doesn't cover you anymore. So people are probably saying, well, geez, what good is Medicare? And the truth is, Medicare by itself, if you just had Parts A and B, you'd be subject to these large deductibles, okay? But what we're going to get into as we continue on in the presentation is there's choices you have to make because you don't want to be an original Medicare A and B by itself. You're either going to choose a Medicare Advantage plan or you're going to choose a supplemental plan, and I'll explain that as we continue on here. The Medicare Part B has a standard monthly premium this year. It's $185 per month. So if you sign up for Medicare and you sign up for Part B Medicare, and you're receiving Social Security benefits, they're going to take $185 out of your Social Security check each month to cover the Part B premium. If you're still working or you've delayed collecting your Social Security retirement benefits and you sign up for Part B Medicare, then what Social Security will do is they'll send you a quarterly bill that you have to pay. Okay. Higher income households may pay more than the $185. There's what's called an IRMAA, and I'm going to get into that in more details towards the end of the presentation. It's something that I like to make people aware of so that they don't get blindsided by a larger Part B premium. But again, we'll get into that towards the end of the presentation. And again, with the Part B, there is an annual deductible of $257, and this can go up each year. After meeting the deductible, Medicare Part B, okay, pays 80% of covered services, and then you're responsible for the 20% co-insurance. So for example, if you only have Part B Medicare and you go to the doctors, it's only going to pay 80% of your doctor visit. Okay, but most people don't have Part B by itself. Most people also choose a Medicare Advantage plan or a supplemental plan. And again, we're going to get into that as we go through the presentation. So let's talk about some services that are not covered by original Medicare. And this will also help people understand why you don't want to just stay in original Medicare by itself. Services not covered by original Medicare include custodial care, nursing home care, bathing, dressing, or at-home, in-home nursing care on a long-term basis. Okay, so unfortunately, Medicare doesn't cover nursing homes on a long-term basis. Medicare doesn't cover hearing aids or hearing exams. Medicare by itself also doesn't cover routine eye care, eyeglasses, but they will do one pair of eyeglasses after cataract surgery. Okay. And Medicare by itself also doesn't cover dental care, dentures. Okay. And Medicare also doesn't cover any type of health care received while you're out of the country, unless it's on an emergency basis. That's the only time they'll cover that. So, true or false? Original Medicare has an annual out-of-pocket maximum. The answer is false. Okay. If you remember, I mentioned earlier that if you go into the hospital and you have only original Medicare Part A, you're going to pay the first $1,676 out of your pocket for days 1 through 60. Okay. If you go back in the hospital later in the year, you're going to pay an additional $1,676 for that hospital stay, for each hospital stay. Okay, so there is no out-of-pocket maximum that you reach where Medicare will start to pay for everything. Okay, which again is why you really need to make a choice when you're Medicare eligible to either go into a Medicare Advantage plan or a supplemental plan. Again, we'll talk more about that here in a minute. Okay. So let's talk about Part C Medicare, because this is probably where the majority of the people attending this presentation and the majority of my clients end up. They end up in what's called Part C Medicare, which is a Medicare Advantage plan. Okay. From a statistical standpoint, right now, here in New York State, just over 80% of the people who have Medicare are enrolled in a Medicare Advantage plan. Okay, so almost everybody goes into a Medicare Advantage plan, as opposed to staying in original Medicare by itself or choosing a supplemental plan. Okay, so a Part C plan, a Medicare Advantage plan, These plans are offered by private insurance companies, and they may include a lot of extra benefits. Okay. And most Medicare Advantage plans, Part C plans, also include prescription drug coverage, which is actually Part D of Medicare. And we'll get into that in a few minutes here, too. These Medicare Advantage plans, if you're not familiar with them, they're offered by the large insurance carriers. For example, Aetna, Excelis, Blue Cross Blue Shield, United Healthcare, Univera, MVP. So they're offered by these carriers. And when you go into a Part C plan, you're actually coming out of the Medicare system and being covered by the private insurance companies. And when these private insurance companies agree to take you as a client, what they're actually doing is they're saying, okay, we're going to give you all the benefits of original Medicare Parts A and B, but we're also going to give you some additional coverage as well. Okay. These plans, these Medicare Advantage plans, sometimes they have a monthly premium depending on which plan you choose, depending on which carrier you choose. But there are a lot of Medicare Advantage plans, a lot of really good Medicare Advantage plans by really good insurance companies where there is no monthly premium. You don't pay anything for it. The only requirement to have the Medicare Advantage plan is that you have to already be enrolled in original Medicare A and B. And remember, with original Medicare, the Part B of original Medicare, there is a monthly cost to that that I talked about earlier. And in 2025, that monthly premium for Part B is $185. Okay, so you still have to pay that in order to go into a Medicare Advantage plan. Right. The nice thing about these Medicare Advantage plans, again, known as Part C, is some of these plans include additional amenities and services that original Medicare doesn't cover. For example, I had mentioned earlier that original Medicare doesn't cover dental, doesn't cover hearing aids, doesn't cover vision. The Medicare Part C, Medicare Advantage plans, many of these plans do offer as part of the plan at no additional cost. They do offer some dental coverage. They do offer some hearing aid coverage, some vision coverage. And some of the plans also provide what's known as an OTC benefit, an over-the-counter benefit. Some of the plans will give you a fixed dollar amount to spend every quarter on OTC items, which are basically pharmacy items. There's a few in our area this year, for example, that give you $50 every 3 months that you can choose items out of a catalog. Typically, they're like Band-Aids and vitamins, things like that, and things you'd find, in a drugstore. And one of the best things about the Medicare Advantage plans, the Part C plans, is that they're required to provide what's called an out-of-pocket maximum. Okay. If you remember earlier when I was talking about the original Part A and Part B of Medicare, there is no out-of-pocket maximum. So what that means is if you have original Part A and Part B, and you have to go in the hospital 3, 4, 5 times during a year, you could be hit with some really high out-of-pocket costs. With the Medicare Advantage plan, if that were to happen, once you reach an out-of-pocket maximum that you paid out of your pocket in a calendar year, once you reach $8,900, then the plan will pay for everything after that point. So there's no additional cost to you. So the out-of-pocket maximum is something really important that people need to consider. With the Medicare Advantage plans, again, with the Part C plans, there are different types of plan. There's what's known as an HMO and a PPO, private fee-for-service plan, and a special needs plan. Let's talk about the HMO for a minute. That's probably one of the most common types of Medicare Advantage plans, okay? The Health Maintenance Organization. What that basically means is that if you choose a plan that's an HMO, you have to use their in-network providers, okay? And generally, you have a primary care, and they help kind of arrange and keep track of all your medical needs and your referrals. Years ago, with the HMOs, a lot of the HMOs required that you had to have permission from your primary care doctor, permission from the hospital, pre-approvals to do things. We have found that's not the case anymore. Most of the HMOs don't require you to have pre-approval for things. Okay, you just have to choose a provider that's in their network. Okay. Preferred provider organization, a PPO, that's another popular one. The PPOs actually allow you to go to out of network providers. Okay, so with a PPO, generally you have in network providers like an HMO, but then you also have the ability to use that insurance to go to a provider that's not in network. Okay. Sometimes the PPOs are more popular with people that travel, that are going to be away for, several months at a time. And they're worried that if they travel to Arizona or to Florida and they get sick, they want to be able to see a doctor down there of their choosing. But if you choose an HMO and you're traveling and you get sick, the HMO will still cover you out of network on an emergency basis. So if you get sick and you're away from home and you go to an urgent care or you have to go to the hospital, the HMO will still cover you on an emergency basis. It just doesn't give you the opportunity to choose a provider of your choice. You just have to go to the whatever emergency services are available there. Private fee for services, most of the carriers are getting away for the private fee for services just because the cost of administering those are too high. So we don't really see many plans that offer that anymore. And then under Medicare Advantage, there's also what's known as special needs plans. Okay, these are generally for people that fall in one of two types of criteria. They're generally for people that have a chronic condition, okay, such as diabetes or heart conditions, or those who are eligible for Medicare and Medicaid. If you remember earlier, I told you it is possible to have Medicare and Medicaid at the same time. And for individuals that have Medicare and Medicaid at the same time, they can go into a Medicare Advantage plan that's known as a dual SNP. Okay. The chronic conditions, those aren't real popular. A lot of the carriers are getting away from offering special needs plans for people with chronic conditions. Okay. So let's talk about choosing a Medicare Advantage plan. Okay, a Part C plan. And I did mention earlier that if you choose to go the Medicare Advantage route, the Part C route, again, you must have original Medicare Part A and Part B. Okay, and then you may have to pay an additional monthly premium for the Medicare Advantage plan. But again, there's a lot of carriers and a lot of really good plans that have a zero monthly premium. When we're working with clients, what we do is we have a program where we plug in their medications, we plug in their providers, and that program will kind of shop all the different carriers for us, and it'll tell us if they're um, if the insurance carrier is in network with their provider. It'll tell us if their medications are covered properly. So when you're choosing a plan, if you use an independent broker like myself, we kind of look at everything for you and make sure that you're going to be covered properly before you make a choice of which carrier to go with and which plan to choose with that carrier. Okay. The nice thing about Medicare Advantage Part C is there's no underwriting involved. As long as you have Medicare Part A and Part B, you can enroll in a Medicare Advantage plan. There are very limited times when you can enroll in the plans, and I'm going to get into that here in a few minutes. Okay. The other nice thing about the Medicare Advantage plans, which I mentioned earlier too, is that these plans, most of them have some extra benefits. Most of them have some sort of dental coverage, whether it be a cleaning or 2 cleanings per year. Some give you a flat fee to use for dental. Some might give you, we have an MVP plan in our area that gives you $750 per year to use for dental. They also generally give you a fixed amount for eyeglasses or contacts, generally around $200 a year that you can use. They generally help pay for hearing aids. The other nice perk that most of the plans come with is, a lot of people know this, is silver sneakers, where they give you a gym membership. There's different programs depending on the carrier. Some call it Silver and Fit, but anyways, most of these Medicare Advantage plans also give you the gym membership for free, and then they also give the over-counter allowance, which I talked about earlier. All right, so let's talk about enrolling in a Medicare Advantage plan, because there's only certain times that you're allowed to enroll in a Medicare Advantage plan. And again, the Medicare Advantage plan is the Part C Medicare. And a little later in the presentation, I'm going to talk about enrolling in Medicare from the beginning. But this just pertains to actually enrolling in a Medicare Advantage plan, a Part C plan. Okay. If you want to enroll in a Medicare Advantage plans, the first time that you have to do that is what's known as your initial enrollment period. Okay. And that's 3 months before you turn 65. Okay. And the month you turn 65, and then 3 months after. Okay. You really want to do it if you know you need the Medicare at age 65, the month you turn 65. You really want to try to do it in the 3 month window beforehand. Okay. Because if you enroll in a Medicare Advantage plan in the 3 month window before you turn 65, it'll be effective the month you turn 65, the first day of the month you turn 65. Okay. If you wait until after, then you're going to be without coverage, and your effective date of the coverage will be the month after the application is submitted. So if you waited to 2 months after your 65th birthday to sign up for a Medicare Advantage plan, the coverage won't actually begin until 3 months after your birthday. So you may have gone 2 months without without the Medicare Advantage plan, without the additional coverage. Okay. If you have Medicare before age 65, for example, if you're on Social Security disability, which is again a lot of the clients that we help, you'll have a second, what's known as 7 month initial enrollment period when you turn 65, when you can change your Medicare Advantage plan or enroll again initially. There are some other Medicare Advantage enrollment periods, okay? And we're coming up to one right now, what's known as AEP, Annual Enrollment Period. And that runs from October 15th to December 7th, okay? And this is the time of year where you start to see a lot of advertisements on television, talking about the Medicare Advantage plans. People that are 64 and older, they'll start to get things in the mail from the carriers. You may start to receive phone calls. I will warn people about receiving phone calls. If you're receiving a cold call from somebody about Medicare, what I would say is just ignore that, hang up on them, don't give them any information. They're really not supposed to cold call anybody for Medicare. CMS, Centers for Medicaid Services, they actually have rules that prohibit carriers from doing that, but there are still some unethical carriers and agents that will just make cold calls. Now, this is not to say if you have a prior business relationship with a broker or a financial planner, they're allowed to call you. But just somebody calling you out of the blue that doesn't know you, that's actually not allowed. But they still do it. So the way they get away with it is they actually use companies that are not in the country to make these calls, and that's the way that's how they get around it. So if anyone's calling you, cold calling you, just ignore them and just hang up on them. Okay. So the other enrollment periods for enrolling in Medicare Advantage plan, if you didn't enroll, okay, during the annual enrollment period or when you first turn 65, okay, the other enrollment period is what's known as a special enrollment period, okay, and you can only make changes or enroll when there's special conditions. For example, if you change addresses, if you move, but you have to move out of your provider's area, okay, you can switch your Medicare Advantage carrier, okay. The other time that you're allowed to switch a Medicare Advantage plan or enroll in Medicare is if you were working or your spouse was working and you were covered by what's known as their employer group coverage. Okay, so if you had health insurance through your employer or through your spouse's employer, you're entitled to a special enrollment period that would allow you to enroll in Medicare, in Medicare Advantage, and in a Medicare Advantage plan. Okay. The one thing about the employer group coverage, though, is to be eligible for the special enrollment period, if you were working or your spouse was working, the employer group plan has to have at least 20 employees. Okay, so if it's a small company, you may not be if it's less than 20 employees, you may not be eligible for a special enrollment period. So you have to be, cognizant of that. All right, and then there's also what's known as a Medicare Advantage open enrollment period. Okay, this runs from January 1st to March 31st of each year, and it's only for people who want to switch their Medicare Advantage plan that are already in a Medicare Advantage plan. They can still switch their plan January 1st through March 31st. Okay, so we see this happen a lot where somebody comes to us during this time of year, during the annual enrollment period, October 15th through December 7th, and they say, Dave, I want to try the plan, let's say with XYZ carrier, and we submit an application, we put them in that plan. Come January 1st, they have coverage with that plan and they go to use it, and for whatever reason, they don't like it. Maybe their doctor stopped taking it. Maybe it's not covering one of the medications the way they like. So if that happens, say in January, you can switch Medicare Advantage plans for the first 3 months of the year. If you're not happy or for any reason, you can switch your Medicare Advantage plan in the first 3 months of the year. Once you get past the first 3 months of the year, you're basically stuck with that plan until the next annual enrollment period, which again, it runs from October 5th to December 7th. The annual enrollment period, October 15th through December 7th, when we do applications or you want to change plans during that enrollment period, the effective date of the coverage will be for January 1st of the year after. Okay. So we've been talking about Medicare Part A, Part B, Part C. Let's talk about Part D. Part D is prescription drug coverage, okay? And this is really important too. Part D, prescription drug coverage, is offered by the insurance carriers, the ones we've been talking about. Again, Aetna, United Healthcare, WellCare, Blue Cross Blue Shield, MVP, they all offer prescription drug coverage, Part D coverage, okay? Part D plans are required by federal law to offer the basic benefits offered by Medicare, okay, which they all do. All the private companies, all the private carriers give you at least what the government says they have to give you. And then each Part D plan has its own list of covered drugs called the formulary. Okay. So what the carriers do, what the insurance companies do, is they look at every medication that's out there on the market and they rank them into tiers, typically tiers 1 through 5. Okay. And then they determine which drugs they're going to cover and which drugs they're going to not cover. Okay. For example, one carrier may cover Wegovy and another carrier may say, nope, we're not going to put it on our formulary. We're not going to carry Wegovy. And I'm not picking on Wegovy. I'm just using it as an example. But it's not unusual for one carrier to cover it and another carrier not to cover a particular drug. Okay. But again, when we're helping our clients, what we're doing is we're plugging their drugs in, their medications in, and we're making sure that whatever carrier we choose for you or help you choose, that your medication is going to be covered. Okay. So again, the carriers, they rank the drugs on tiers 1 through 5. And then typically a tier 1 drug will have a very small copayment or no copayment at all. Typically a tier 1 drug is your preferred generic drugs. Then a tier 2 drug may be generic drugs in general, but not a preferred one, and there'll be a larger copayment. And then tiers 3 through 5 are generally your more expensive drugs, okay, that can come with larger copayments, okay? When you're choosing a prescription drug plan, a Part D plan, okay, you can do it one of two ways. You can purchase a Part D plan by itself. Okay, the carriers will sell you a Part D plan by itself to help cover your medicines. Okay, but if you choose to go with a Medicare Advantage plan, a Part C plan, most of the Part C plans will include the Part D as part of that. Okay. And if you remember earlier, when I first started talking about the Part C plans, the Medicare Advantage plans, I did say that some of these plans have a monthly premium, and a lot of the plans have no monthly premium at all. The only requirement is that you have Parts A and B Medicare and that you pay your Part B premium. Okay. So a lot of the Part C plans, the Medicare Advantage plans, include the Part D. Okay. So I like to tell people that if you choose a Medicare Advantage plan, if you choose a Part C plan, it's going to wrap everything into one. It'll wrap A, B, C, and D all into one plan for you. Okay. Um, So Part D changes for 2025. We don't know what, actually, we do know the changes for 2026, and I'll tell them. I'll tell you what they are here in a second. But with the Part D prescription drug plans this year in 2025, there is an annual deductible of $590. Okay, so typically, with some of the plans, you have to pay the first $590 of your prescriptions out of your pocket before the plan will start paying. Okay, in 2026, that's actually going to $615. Okay, some of the carriers, some of the insurance carriers, um, don't require you to pay the annual deductible for tier one or tier two drugs. So a lot of times they'll cover the generic drugs with no cost to you or a small, say $5 copayment, and they won't require you to pay the annual 590 out of your own pocket. Typically, it's not until you start people need tier 3 through 5 drugs that the carriers will require you to pay that annual deductible out of your pocket. Right? Um, for 2025, once you pay $2,000 out of your own pocket for prescriptions, once you hit that point, then the carriers will pay 100% of the cost of that medication. Okay. These limits are actually new for 2025. If some of you remember, Medicare used to have what they called a donut hole, and it was a much more complicated system of what the maximum out of pocket was, and there were different stages that people would go through when they were paying for their prescription drug coverages. They did away with that in 2024, and they just went to this one flat fee that basically says, okay, if you're taking tier 3 through 5 medications, and you end up paying out of your own pocket for your copays and your annual deductible, once you pay out of pocket $2,000, then the carriers have to pay 100% of that medication for the remainder of the year. Okay. In 2026, again, that $2,000 limit is actually going to $2,100 for 2026. Okay, so this chart, this screen here, kind of ties things together. If we start at the top left-hand corner of the screen, where you see it shows Part A hospitalization coverage and or Part B medical insurance coverage. Okay, so everyone that's on Medicare is going to have, most people that are on Medicare, I should say, are going to have Parts A and Part B. All right. Once you're on Part A or Part B, then you have to make a decision, okay, of whether or not you want to choose a Medicare Advantage plan, which I've been talking about, which is a Part C plan, which is shown on the right side of the screen. Okay. And again, if you go that route, if you go to the right side of the screen and you go and you choose a Medicare Advantage plan, you choose a Part C plan, that's going to wrap all your Medicare parts into one. So Parts A, B, and D are all wrapped into one with a Medicare Advantage plan. All right. The other choice you actually have two other choices. You can elect to stay in original Medicare Part A and B and not do anything, which I wouldn't advise anyone to do because there's large gaps in the coverage. So it is, if you don't want to go the Medicare Advantage route, the other choice you have is you can go the Medicare supplement route, okay? Which for years was really the only choice you had. Before the Medicare Advantage plans came onto the market, people had to choose a supplemental plan to go along with their Medicare, okay? And I'm going to talk about the supplemental plans in a little more detail here in a second. But basically, the supplemental plans um, pay for things that Medicare doesn't cover. All right. When you have a supplemental plan, you also have to choose a separate Part D plan, a separate prescription drug plan. Okay. So the supplemental plans are what's known as Medigap plans. They cover things that original Medicare doesn't cover. And again, a supplemental plan is only if you choose not to go the Medicare Advantage route. You can go the supplemental route. Okay. If you choose to go the supplemental route, or the Medigap supplemental route, they will work with your original Medicare A and B. Okay. And again, they're designed to help pay some of the costs that original Medicare doesn't pay, such as co-payments, co-insurance, deductibles. Um, each Medicare supplemental insurance plan has different benefits, and they may be attractive because they're not limited to a specific network of providers. Okay. If you remember when I was talking about the Medicare Advantage plans, the Part C plans, you're either going to be in what's known as an HMO or a PPO. And if you're in an HMO, you have to use in-network providers. If you're in a PPO, you use in-network providers or out-of-network providers. But if you use out-of-network providers, there's larger co-payments. Well, with a Medicare supplemental plan, you can go to any doctor or any hospital that accepts Medicare. Okay. And I know that sounds really enticing, but we're going to get into why these plans here in a few minutes, why these plans are not so popular anymore. And it basically comes down to cost. Okay. But again, these plans, Medigap plans, supplemental plans, there's generally 10 different plans that are available. Okay. And they actually categorize the plans with alphabetical numbers. Let me come back to this, or alphabetical, plan A, plan B, plan C, plan D. I'll go back to this in a second. But so these plans are offered by all the same insurance companies that offer the Medicare Advantage plans that we've been talking about. Okay. But here's the biggest negative with these plans is that there is a monthly premium and it varies by state. Okay. Here in New York State, if you chose a plan G supplemental plan, that plan would cost you $429 a month. Now that's on top of your Part B premium that you pay to Social Security, the $185 a month. You'll pay an additional $429 per month. Okay. As an example, for 2026, in Dutchess County, if you want a plan G in 2026 through Humana, that's going to cost $547. Okay. The same plan G here in the county that I live in, Monroe County, would be $441. Okay. So there is a monthly premium to be in a supplemental plan. Okay. And the other thing with the supplemental plans too is, again, they don't cover any prescription drugs. So you have to purchase a separate Part D plan, prescription drug plan. Okay. With the supplemental plans, there is a one-time open enrollment, okay, for 6 months after your Part B starts, okay, where they have to accept you into the plan. It's guaranteed enrollment into the plan, okay. If you don't sign up for a supplemental plan when you're first eligible, okay, when your Part B first becomes effective, and you want to sign up at a later date, for example, 3 years after, maybe at age 70, you decide you want to go into supplemental plan, you can do that, but there's going to be, in most states, there's going to be underwriting involved, okay? So, again, supplemental plans, when you first go on to Medicare, they have to accept you, okay? After that, if you want to enroll, depending on what state you're in, you have to go through underwriting, okay? And they're not required to accept you if you have certain medical conditions. Okay. There are some states that have a guaranteed issue period, okay, without underwriting, okay. And those states are Maine, Connecticut, Massachusetts, and New York. So in those states, because there really is no underwriting involved, you can go into a supplemental plan at any time without going through the underwriting process. But the problem with that is that's one of the reasons why the monthly premium on those plans, and I was giving you examples here in New York State, the monthly premiums are so high. Okay, I had mentioned that here in New York, a plan G through Humana for this year was $429. Okay, that same plan in Florida, because Florida doesn't have guaranteed issue, okay, that same plan would be $231. Okay, so almost half of what it is here in New York. So the states that have the guaranteed issue where there is no underwriting, the monthly cost of those plans is obviously going to be higher. It's insurance, so they have to spread the cost around for having the guaranteed issue. So what the supplemental plans, what the Medicare plans, you choose a plan A, B, C, D, F, G, K, L, M, N. A lot of these plans aren't even offered anymore, and I'm not going to get into the nitty gritty of these because again, they're not really all that popular in our area. But if you want to look at them, I could forward you the information on the supplemental plans. Okay, so what's the difference? I've been talking about choosing a Medicare Advantage plan or going the other route with a supplemental plan. So what's really the difference here? Okay. Let's go back to Medicare Advantage Part C plans. Okay. Again, they usually have a network for best cost savings. They usually include Part D coverage. They almost always include Part D coverage. Okay. And the benefits with the Medicare Advantage plans have to be as good or better than original Medicare. Okay. With the Medicare Advantage plans, the Part C plans, it's guaranteed issue. There is no underwriting. They have to accept you into the plans. There are certain enrollment periods, so you have to be aware of that and be careful with that. That there's only certain times you can enroll in a Medicare Advantage plan. And again, to go into Medicare Advantage plans, you have to be enrolled in Medicare Part A and Part B. Okay. Let me mention something about the networks here with the Medicare Advantage plans. Most of the carriers, most of them, are going to have very, very large networks. For example, where I live here in the Rochester area in Monroe County, we have two large health providing conglomerates, one known as Rochester Regional Health, the other known as U of R. And 95% of our doctors or our providers are part of either one of the conglomerates or the other. And most of the carriers, the insurance companies in our area are in network with both of the conglomerates. So basically, they're in network with 95% of the doctors in our area. So the network criteria is not an issue, especially in our area. And, we can check any parts of the country to see what their networks are and if a provider is in network with a certain carrier or not. Okay, but for the most part, it's usually not a problem. Right? So again, going on to the Medicare supplement plans, you can go to any provider that accepts Medicare anywhere in the country. So that is one advantage. But again, it does not, if you choose the Medicare supplemental route, it doesn't include the Part D coverage. So you have to purchase a separate Part D plan through one of the carriers. The cost of the Part D can range depending on which plan you choose, what it covers, what medications, tiers your medications fall on. But a typical Part D plan is going to run you anywhere from, for an okay plan, $50 a month to $150 to $200 a month. Okay, so that would be on top of the cost for the supplemental plan, the $400 here in New York. And again, the Part D plans don't include any dental coverage. They don't include any vision coverage. They don't include any hearing aid coverage. But with the Medicare supplemental plans, if you choose a plan, F, G, and whichever plan you choose, the coverage that it gives you has to be the same anywhere in the country. Okay. And again, with the supplemental plans, if you don't enroll when you're first eligible, then you may be subject to underwriting, sharing one of the guaranteed states that I had mentioned. And again, just like with the Medicare Advantage plan for a supplemental plan, you have to be enrolled in parts A and B. There is a monthly premium, which I've talked about, and it varies by state. And then those monthly premiums on these plans can increase each year. Okay. So as I mentioned, the Humana plan, Plan G in Monroe County, this year in 2025, it's $414. That same plan next year is going up to $441. So there are premium increases for the supplemental plans each year. All right, so let's talk about when to enroll in Medicare. Okay, so we've kind of covered A, B, C, and D Medicare. Now let's talk about when should you enroll in Medicare if you're not already enrolled, or when can you enroll in Medicare? Because there's only certain times that you're allowed to do this. Okay, the first time that you're allowed to do it is what's known as your initial enrollment period. Okay, and it's a 7-month time period that you can enroll. It starts 3 months before you turn 65. It includes the month you turn 65, and it includes 3 months after you turn 65. Okay. If you enroll during your initial enrollment period, if you enroll the 3 months before you turn 65, then the Medicare will be effective on the first day of the month you turn 65. So if you're turning 65 on December 20th this year, and you enroll right now, your Medicare will be effective December 1st of this year. Okay. If you wait to enroll into your 65th, the month you turn 65, if you do the application for Medicare in the month you turn 65, then it's going to become effective 1 month after that. So if you're turning 65 on December 20th this year and you do the application in December, it won't be effective to January 1st. All right. And then if you wait 2 months after you turn 65, it's going to be effective even later than that. So it's really important that you enroll early, okay, so that you don't go without coverage. So that was your person's initial enrollment period, generally when they're first turning 65, 3 months before, the month of, and 3 months after, okay. You can possibly be eligible for a special enrollment period to enroll in Medicare, okay, at a later date. But in order to enroll in Medicare, if you missed your initial enrollment period, in order to enroll in it without any penalties or any problems, you have to be covered by an employer group health insurance plan. Okay. If you're covered by an employer group health insurance plan, and again, that is an employer plan where there's 20 or more employees there. Okay. If you're covered by their plan, or your spouse is working and you're covered under your spouse's plan, then you can wait to enroll in Medicare. Okay. If you're working or your spouse is working, you're covered by their plan, you can enroll in Medicare at any time after your 65th birthday. Okay. If your spouse or you stop working, then you only have an 8-month window to enroll in Medicare from the point that you stop working. Okay. So it's very important that you don't miss out on those dates. And generally what happens if you're covered by an employer plan, when you enroll in Medicare, so the Social Security office, who you're doing the application with, will require you to have your employer fill out a form to prove that you were covered by that plan. Okay. And then you have to submit that to the Social Security Administration with your Medicare application to prove that you were covered by an employer plan. Okay. When to enroll in Medicare. Again, the last period is what's known as a general enrollment period, okay, which is January 1st through March 31st of every year, with coverage beginning the month after you sign up, okay? So if you fail to enroll in Medicare during your initial enrollment period and you don't have a special enrollment period because you weren't covered by an employer group plan, you can apply for Medicare January 1st through March 31st of every year, with the coverage becoming effective the month after. So if you file or apply for Medicare through the Social Security office in January, then the coverage will become effective February 1st. Okay. If you do it in February, it won't become effective until March. Okay. Now, there is a problem with signing up during the general enrollment period. Okay. And the problem is that you may be hit with a penalty on the Part B premium for enrolling in the general enrollment period. If you were already eligible to enroll and you failed to enroll, and then you're doing it in the general enrollment period, Social Security is going to hit you with Medicare is going to hit you with a 10% penalty for every year you're eligible to enroll that you didn't enroll. Okay. And the reason they do this is like with any insurance, they don't want you enrolling for this insurance when you need it. They want you enrolling it from the beginning when you're first eligible. Okay. So just be aware that these enrollment periods with Medicare are very specific. And if you wait to enroll to when you need it, you're going to get hit with a 10% penalty. And if you miss the general enrollment period, you're not going to be able to enroll in Medicare until the next general enrollment period. Okay. So if you're not in Medicare and you're 65 and older and you say, oh, geez, I should have enrolled. And then June comes around and you go, okay, I'm going to enroll in Medicare. Social Security is going to be like, no, you can't enroll in Medicare in June. Okay. You don't have a special enrollment period. It's not your initial enrollment period. You got to wait to the next general enrollment period, which again is January 1st to March 31st. Right? So I know I'm throwing a lot of information at you guys, but basically what it boils down to is when you become Medicare eligible, you got to make some choices, okay? And there's some different things you want to look at when you're making your Medicare choices. Of course, cost is one of the biggest factors, okay? How much are you going to pay? How much are you going to pay for premiums, deductibles, co-insurance, co-payments? What are the benefits that you're getting, okay? What's the convenience? Are the plans in network? Are they conveniently located? And I've kind of touched on that. And then, do you have special needs in future years? Do you anticipate, your medicines are going to increase? So there's a lot you have to look at. And of course, the providers, which we talked about. And again, the nice thing about when we're helping individuals, we plug in their zip code and then we plug in the providers and their medicines. And my software compares all the carriers side by side and tells me what each carrier is going to charge you for a plan, what each carrier is going to cover your medications, where those medications are going to fall on the formulary. Okay. So the best thing to do is to start planning ahead of time. Just, get an idea of what you want to do. Reach out to, a licensed Medicare representative to kind of help you navigate all this stuff. The other thing too about using a licensed representative like myself is there is no cost to you for our services. The way that we're compensated as an independent licensed broker is we receive a commission from the insurance carrier when we place you in a plan. Okay. And the nice thing about that is that our commissions are highly regulated by CMS, by Centers for Medicare Services. And what it boils down to is Medicare says, all right, if you're going to be a licensed independent broker, we don't want you being biased to any of the carriers. So the required commission that you're going to receive is a set amount. It's approximately $350 is what we receive. So whether you choose Aetna, United Healthcare, MVP, no matter what carrier you choose, no matter what plan you choose, with our assistance, we receive the same commission. And again, it's paid through the carrier. So it doesn't come out of your pocket. There's no additional cost to you. The carrier pays us that. So that ensures that we're not being biased, that we're trying to find the best plan for you. Okay, so let's talk about IRMAA.
Hi,
Okay.
David, before you
Yeah.
go forward, we do have a couple questions before
Okay,
you
yeah.
kind of get on to this next phase. I
Sure,
think we
sure.
can hopefully maybe solve some of these things quick. So,
Okay, yeah.
what about you talked about the general enrollment. We have a question. What about the open enrollment, 1015 to 12/7? What did that cover again?
Yeah, so that's a great question. I know it causes some confusion. So when I was talking about the general enrollment period actually refers to people who have not yet signed up for Medicare. Okay. So there's two different enrollment periods that people have to be aware of. The first one is for people that are not yet on Medicare. Those people, if they want to sign up for Medicare, they have their initial enrollment period, which is when they're first turning 65, or their special enrollment period if they were covered by an employer group plan, or the general enrollment period, January 1st through March 31st. So that's for people that need to sign up to start Medicare. Okay. The annual enrollment period, the AEP, which runs from October 15th to December 7th, that's for people that want to choose or switch a Medicare Advantage plan. So the annual enrollment period, October 15th to December 7th, is for people that already have Medicare.
Okay.
Does that help clarify?
Yeah, I think that would help.
Yeah.
That helps clarify. I mean, Mark, who asked a question, he can maybe comment if he had any additional questions on that.
Okay, that's
And
a
then
good question.
related,
Go ahead.
yeah, no, I thought that was a good
Very
question. And then
confusing.
related to that, we had, where are we? If you're 65 and still working, do you still have to enroll in Medicare or wait until you're retiring and follow for that 3-month leeway?
Yep. So that's a great question. So if you're 65 and you're still working and you're covered by your employer's group health plan, and there's 20 or more employees there, you do not have to enroll in Medicare until you stop working. You are entitled to what's called a special enrollment period. So if you want to enroll in Medicare once you stop working, then the effective date is the month after you submit the application to Social Security.
Yep.
Because you're
And that
following
20 or more, like that is key though. Like if you're in a small plan, you're not, it doesn't matter if you're still working or not.
Yeah.
Okay.
Because if you
I
look
do
at
think-
the terminology actually says employer group plan. So if you're a small employer, there's only a couple of people there, you got to enroll when you first turn 65. If there's 20 or more people that work for that company, then it's considered a group plan. And then you're eligible for that special enrollment period when you stop working.
Okay. If using an out-of-network provider, is the percentage paid based on a negotiated Medicare rate?
So that's a great question. No, when you use out-of-network providers, if your plan allows, if it's a PPO and the plan allows you to use out-of-network providers, two things you need to be aware of. One is that generally you're going to pay a higher copayment to go to an out-of-network provider, okay? And the amount that your insurance carrier will cover may not be what that provider is asking the insurance company to cover. Okay, so there could be additional costs when you go out of network.
Okay. And then just one other comment, and we'll keep going. And then if we have plans, we could, if we have time, we can keep going through some of the other questions. What if your spouse is retired and has insurance for both individuals through their pension?
Okay, the only time that a person in that situation would need to go on to Medicare is if they were covered by if they were federal employees and they were covered by federal employee health insurance. That may be what they're referring to, because that's the only time we see it where they don't have to go on to Medicare. Okay. Generally, for most people, when they retire, if they're working for a public, a private company, a public company, not a government entity, okay, that employer's insurance company and the employer is going to want them to go on to Medicare. Okay. The only time we see it that they don't have to go on to Medicare, okay, is if they were federal employees and they were covered under the old civil service system.
A couple of the questions related to New York State retirees.
Yep.
Similar idea.
Yeah. Generally with New York State, we see that they generally do have to take Medicare. That most of the state government agencies require them to go on to Medicare when they turn 65 or when they retire, if they're retiring after 65.
Okay, and then there was a question related to that. So if they do have that and they need dental coverage, how do they, is there a way to buy it separate, or what do they
There
do?
is the carriers do sell dental plans. I'm not a big fan of them. For example, one carrier came out with a dental plan for 2026, and for their dental plan, they will give you $1,000 in dental coverage, but they want $43 a month to purchase the plan for $1,000 in dental coverage. So you're paying $516 for $1,000 in dental coverage. My point being is that generally these carriers, yes, they offer dental plans, but they're not very good. And some of the dental plans that do give you more coverage, they require like sometimes a 1 to 3 year enrollment period before they'll cover the higher expenses. So generally they're not. I don't recommend most of them, but you can purchase them through carriers. Yeah.
Okay, great.
Now,
All
the
right.
Medicare Advantage plans that I was talking about too, a lot of those plans do include some dental as part of the plan. For example, we have a carrier here in the area that it's probably one of our most popular plans. And when people go into that Medicare Advantage plan, that carrier, for no additional cost, they cover 2 cleanings per year with x-rays and an additional $1,000 in dental on top of that. And that's for a plan with 0 monthly premium. So there are a lot of Medicare Advantage plans that have dental built into them already. Yeah.
Okay.
All right. Any other questions, Anna?
No, go
Okay,
to it,
good.
and then we'll see if we can jump in with any
Okay, good.
others later.
So let's talk about the IRMAA, because the IRMAA can be something that causes confusion, but also can cause a lot of surprise for people. And I know Cindi and Jean, I'm sure you guys do a good job of trying to forewarn your clients that IRMAA is a real thing and they need to be aware of it. But basically, what IRMAA is, if you haven't heard of it, it's what's known as an income-related monthly adjustment amount. So we were talking earlier that when you have Medicare, whether you go a supplemental route or you go a Medicare Advantage route, Part C, you have to have Part B Medicare, okay? And this year in 2025, Part B Medicare costs $185 per month, okay? If you're a higher income earner, okay, or you have a year in which your income went up, you can be hit with an IRMAA, which is an additional charge on top of the 185 per month. Okay. So what this chart here is showing is that for this year in 2025, okay, if you're married and you file jointly and your income is under $212,000, then you'll just pay the regular 185 that everyone else pays for the Part B. Okay. However, if you're married filing jointly and your income is above 212,000, even if it's $1 above 212,000, you and your spouse are going to get hit with an additional cost to your Part B premium. And this year, Medicare will make you pay an additional $74 per month for your Part B premium. So that brings it up to $259 per month for each of you. Okay. And then as the chart goes on, it's incremental here. If you and your spouse fall in the $334,000 to $400,000 range, then you're going to end up paying $480 a month for your Medicare Part B premium. Okay. And what Social Security is using to determine what your income is they're using your modified adjusted gross income on your tax returns from 2 years prior. So in 2025, they're looking at your 2023 tax returns to determine what your MAGI is, to determine if you're going to have to pay a higher premium. And sometimes this takes people by surprise when they receive a letter from Social Security. The letters that Social Security sends out generally come out in November, December, and basically say, hey, you are going to be hit with this IRMAA because your income was at this level. So you're going to pay much more for your Part B premium. Okay. So I like to just make sure people are aware of this. So if it does happen, they're not shocked. It doesn't come as a surprise. And then if there's something you guys can do is financial planners, to help people reduce this or avoid it. I know it's not always easy, or sometimes it's unavoidable, but sometimes, it can be avoided depending on certain circumstances. Okay. If you get hit with an IRMAA, there are ways to fight it. There is an appeals process that Social Security will allow you to file an appeal. And if there's a life-changing event, is what Social Security calls it, such as a retirement in the year you retire, sometimes they will waive the IRMAA. Okay. But the thing with the IRMAA too is it is just for 1 year. So if somebody sold some equities and they had a large capital gain in 1 year and it pushes them into one of these categories, the IRMAA, the additional cost of the Part B, will last just for 1 year. If their income goes down or normalizes in the next year and they're below 212, then the IRMAA will go away. So it's 1 year at a time. So. All right, let's talk about common Medicare mistakes. Okay, we've kind of talked about it here and there through the presentation, but let's go over this list here. Failing to enroll in Medicare when you should, or misunderstanding the enrollment periods, and we had a good question on that. Again, you have a general enrollment, you have an initial enrollment period to enroll in Medicare when you turn 65. If you don't do it then, you may be eligible for a special enrollment period if you were covered by your employer group plan, or you can always do it during the general enrollment period, which is January 1st through March 31st of each year. But again, I don't advise that, because if you use the general enrollment period, you're going to get hit with a 10% penalty on your Part B premium for each year you didn't enroll that you're eligible to enroll. Okay. Another mistake is believing you don't need Medicare Part B because you have retiree or COBRA health coverage. Okay. And somebody asked the question about that, but they were a government employee, New York State employee, and that can cause a lot of confusion. So the best thing to do there is check with your human resource department. It's very, very rare that even government employees don't need to enroll in Medicare. Generally, the only time we see it is with federal employees that fall under the old civil service, and that would be for people that were working for the federal government prior to 1986. Okay. Another mistake is thinking you must be full retirement age before enrolling in Medicare. Okay. Most people today, their full retirement age is age 67. It used to be 65 forever, but it's not for most people now. The full retirement age is age 67. Okay. However, the Medicare age to enroll in Medicare is still 65. Okay. Another mistake is not signing up for Part D because you don't take any prescription drugs. Okay. Again, you don't want to not sign up for a Part C plan, a Medicare Advantage plan, or purchase a Part D plan just because you don't take any prescription drugs, because there's only certain times you can enroll, and then there's additional penalties if you enroll late. And another mistake is choosing a Medicare Advantage plan or supplemental plan based on a friend's recommendation. Okay, please don't do that. The Medicare Advantage plans and what they cover, and the supplemental plans, what they cost, vary from county to county. Okay. So here in Monroe County, where I live, the cost of a Medicare Advantage plan, a lot of the great plans are zero. In a different county in the state, there's different carriers that can provide different plans too, where the cost could be zero or could be more. So again, it's county by county. So don't go based on a friend's recommendation. And it's also individual. What are your friend may not have any medical needs at all, and you may have a lot of medical needs. So it's really individualized. So don't go based on a friend's recommendation. Another mistake, not realizing that you may qualify for help to lower your Medicare insurance costs. This is one I haven't talked about until now, but for lower income individuals, sometimes there are some subsidies that can help pay for your Part D prescription coverage. The income limits for that are pretty low, though. And then there's also people that are Medicaid eligible, okay, but the income for that is also very low. For example, the Part D, the low income subsidy for that, the monthly income limit for a couple is $2,575, and then they can't have assets of more than $32,000 to qualify for the low income subsidy. The Medicare Savings Program, which helps pay for the Part B premium, to qualify for that, your income has to be under approximately, for an individual or for a couple, it has to be under $3,299. Okay, so for low income people, there are some subsidies that are available. And then another mistake is not realizing that you may have to pay an additional premium for the Part B, also known as the IRMAA, which we did talk about. Okay. How to avoid the Medicare mistakes? Doing what you're doing now, attending this presentation, getting some information, starting to prepare 4 to 6 months before your 65th birthday. And again, enlist the help of a Medicare professional. Okay. You can call the carriers directly. They'll help you, or you can call an independent broker like myself who can help you and shop all the carriers for you. We have to be licensed in each state that we provide the services for. I'm licensed here in New York State, and I'm licensed in Florida. If you're in another state, unfortunately, I can't help you. But for New York State residents and Florida residents, I can help you choose a plan and look at all the different carriers. When choosing a Medicare Advantage or supplemental plan, don't rely on a representative who only works directly with one insurance carrier. Okay. If you are wanting to know more information about what Medicare Advantage plans are available, and you call a specific carrier, like their 800 number, you say, for example, you call United Healthcare, they're only going to tell you about their plans. Okay. They're not going to tell you about any of the other carrier plans. So again, with an independent person like myself, we tell you, we shop all the plans. We look at all the plans for you. And then if you're going to be subject to an IRMAA, and again, it's based on your tax returns from 2 years prior, start preparing 3 years ahead of time. If you're going to take Medicare at 65, start preparing at 62, because know what's coming on your tax return could potentially cause an IRMAA and cause you to have to pay more. So sometimes if there are things that you can do to avoid the IRMAA, go ahead and do this. Sometimes you can't, but just being aware of it kind of helps too, so that you're not shocked. And then the other thing too to avoid Medicare mistakes is to review what's known as your annual notice of change, your ANOC letter each year. Now that's only going to apply to people that already have Medicare, already have a Medicare Advantage plan. But what happens is once you're on a Medicare Advantage plan or supplemental plan, then every year the carrier at this time of year has to send you a letter telling you what the changes are going to be in your plan for the year after. Okay. This year in 2025, there's been a lot of changes for 2026. A lot of the carriers are pulling their plans for 2026 and replacing them with new plans. And a lot of my clients are receiving letters saying, hey, your plan is terminating for 2026. You have to choose a new plan. And that's something that we are helping our clients through, helping them choose new plans. But again, that's made known to you through the letter that they're required to send, the ANOC letter each year. Okay. So thanks for your time. Thanks for.
We have a couple more questions, David.
Yeah, absolutely.
All right. Since we have a little bit of time.
Good.
So if you have Medicare and are also covered under your wife's medical plan as your supplemental, how are payments to the doctor treated? Is Medicare the primary and my wife's insurance provider the secondary?
That's a good question. So it depends on if are they receiving Social Security retirement benefits, because it's different for our clients that receive disability benefits. But generally, most of the time, Medicare is going to be the primary payer. They're going to be the ones that are billed first. most of the time. And then what they don't cover, they'll bill the employer plan.
Okay. Is IRMAA evaluated each year? You did discuss that yes, it's evaluated each year. And
Correct.
then in addition, we had someone ask, does IRMAA include my 401k distributions, a sale of a home? Yes.
Yeah.
I think David would agree. Yeah, that all
Yep.
impacts your adjusted gross income, which
Exactly.
they look at 2 years prior. So
Right.
knowing this, you should
Yeah.
plan.
Right.
You
It's
should
based on
plan accordingly.
your MAGI, your modified adjusted gross income.
Yeah.
Yep. So yeah, absolutely. Absolutely
Which
can.
factors all of that
Mhm.
in.
Yeah.
And I think Cindy, she helped me make sure I think I got to everybody's question, but like I said, Cindy was able to let me know if I missed something.
Yeah, there was one other, let's say that if you have Medicare and you're also covered under your wife's medical plan as your supplemental, how are the payments to the doctor treated? Is Medicare primary, or is your wife's insurance provider secondary?
Oh, we
Yeah,
did go over that one. Yeah.
Yeah. That one, generally, the Medicare is going to be primary first.
Does that matter if it's a 20 or more
No,
person plan? Okay.
no.
Okay.
The other thing too about primaries, I'll mention this too, is no matter what route you go with Medicare, whether it's original, whether it's Medicare Advantage, Part C, or whether it's a supplemental plan, when you go to your primary care doctor, if it's for an annual well visit, like a physical, there is zero copayment and zero cost for those always, no matter what Medicare plan you have. Okay.
That's helpful.
Anything preventative under Medicare is zero cost to you, zero co-payments for that.
Okay.
That's good to know. And then those last questions too, right? The person said they're 64, they plan to work until they're 68. I'm currently covered by my employer's group plan, has 20 more employees. Do I need to do anything before I turn 65?
Nope. You could sign up for Medicare Part A, the hospitalization coverage, because there's no charge for that. Okay. But because you're still covered by your employer, your employer group coverage, you don't need to. You'll be eligible for a special enrollment period to enroll in Medicare at any point between 65 and when you stop working. So
Okay.
you could wait until you stop working and then enroll in Medicare. Yep, you can do that.
And that's that special enrollment period that you
Correct.
talked about.
Yeah, and then your employer, Social Security would give you a form. I have them for your employer to fill out to prove that you were covered by their plan, and then that would waive any penalties and give you the special enrollment period. Yeah.
Excellent. And last question here. Can I contribute to an HSA if I'm still working with a high deductible plan and haven't gotten Medicare yet?
Yeah, that one I can't. That has nothing to do with Medicare. So actually, I don't. I don't.
So
know of any
Cindy and I
rules
will
from
jump in.
that.
We
Yeah.
know.
Yeah, I was
So-
gonna say.
Right. Yep,
Yeah, I
yep,
was gonna say,
yep,
we'll
yeah.
jump
So
in.
there's nothing in the
and
Medicare
know.
laws that prohibit
Yeah.
that, but I don't know if
Yeah.
there's other IRS
Yeah.
laws. But yeah, nothing in the Medicare law.
If you're in a high deductible plan and you're not on Medicare, yes, you can continue to contribute to your HSA. But Cindy, can you talk real quick for the people that have an HSA? And I know you've dealt with this with a couple of our
Yeah.
clients where their HSA through, let's say, May, and then they go on Medicare in June.
Yeah.
What
So
happens
if
in that year? Yeah.
let's say that you apply for Medicare after age 65, maybe you're still working and you had the special enrollment period. Medicare, when you apply for Medicare, it's considered retroactive for 6 months, up no further back than age 65. You cannot be contributing to an HSA at the same time you're considered covered by Medicare. So you have to plan ahead. You have to stop your HSA contributions at least prior to 6 months before the time you're going to apply for Medicare to avoid that retroactive treatment and getting hit for the HSA. There will be a penalty if you do.
And there's ways if you catch it in time to get that if you by chance made that HSA contribution to kind of get it back out.
Yeah, get it refunded. Yep.
Get it refunded. So yes, so Cindy and I, so David, you did an incredible job kind of going over the Medicare, the nuances, what we need to think about. And as you saw, we had a decent amount of questions. It's going to be great material for all the participants to get and refer back to along with the recording that will go out in a week. But as Cindy and I were interjecting and weaving things, we also do all the planning and the estate planning for members, whoever. Actually, there is no members. It's whoever needs that assistance. So if there's any planning or estate planning needs that we can help you with, please, reach out to us as needed.
Yeah, anything to do with your personal finances, whether it's a single specific area or a bigger picture, more comprehensive, we can help you with that.
Great.
Thank you.
Any other questions?
One just came in right before our noon time. You mentioned that Medicare Advantage plans have 0 premiums. How do they provide additional services for free?
That's a great question. So what happens is if you elect to go with Medicare Advantage, okay, what's happening in the background is Medicare, CMS, Centers for Medicare Services, the government pays the insurance companies to cover you. Okay. So if you go Medicare Advantage, the insurance company says, yep, we'll take the risk. We'll cover you because we know we're going to get reimbursed from Medicare. So just for conversation's sake, let's say Medicare agrees to pay each carrier $1,000 a month to cover you. Okay. And the carriers say, yep, we'll take that risk. We'll take the $1,000 per month from Medicare. And I'm just making $1,000 up. They don't tell us how much they pay them, but let's say it's $1,000 a month. So the government, Medicare, pays the carrier the $1,000 a month to cover you. And the carriers, because they want the business, they say, okay, how much is it going to cost us to cover most of these people? And then they build into their plans all the extra benefits, and then they take the risk of covering you. And because what the government's basically doing is they're providing competition amongst the carriers. So the carriers are competing for your business. They want you to go with them so that they can be reimbursed that set fee from the government. So in order to do that, in order to win your business, they offer these ancillary benefits: the dental, the vision, the hearing aids. So that's how they do it.
Excellent. Thank you, David. Well, right on time here. Great job. Thank you for all your information and your time.
You're welcome.
Again, everybody, this will be sent out to you in a week, but feel free to follow up with David as needed as well. Thank you, everybody.
Thank you.
Thank you.
Thank you, everyone.
Yep.
Have a good
Bye.
day.
Bye, guys.
Bye.